Now, just 5 positive cases shy of 9,000 across Indiana. 436 Hoosiers have sadly died of this virus since that outbreak started. More than 48,000 have been tested all across our state, and a few hundred more positive cases from our last update yesterday. As the debate continues from the White House to the State House about when to reopen the country and Indiana's economy, the coronavirus outbreak models that the experts are depending on are giving varying answers. Our Russ McQuaid is showing us why some researchers believe Indiana hasn't hit our peak yet.
45% of Indiana's ICU beds and 74% of its ventilators are still available for the most seriously ill Hoosier COVID-19 patients. And that means when the surge hits, the state's hospitals are well positioned to handle it.
We're interested in looking at where people are and where we think kind of the next wave will be.
A study by the Fairbanks School of Public Health looks at the county-by-county data to predict when the surge will hit Indiana.
We believe that Indianapolis and the rest of and the other parts of the state will hit their peak over the next few weeks into early May. Our level of hospitalizations in the center part of the state have been flat. In other parts of the state, they're still climbing up.
A model by the Institute for Health Metrics and Evaluation based on general overall state numbers once predicted the Indiana peak would hit last week and then earlier this week. It still expects more than 800 Hoosiers to die from the coronavirus, which is about what the Fairbanks model is also forecasting.
All of the models that I'm referring to are right in that ballpark of around 800 or 900. Again, with the caveat, as you said, those numbers have fluctuated. It looks like they might be stabilizing, but we'll have to look and see what tomorrow holds. The general trend has been towards stabilizing down under 1,000.
And the analysts say Indiana may have undercounted earlier deaths that weren't identified as positive cases, and that could add to the mortality total.
We continue to backfill in the mortality statistics and continue to learn more about what the case presentation looks like, so that an astute clinician may look at this and say that looked like it was a COVID-19 case.
As to when he thinks that, based on the numbers, Indiana's stay-at-home order may be lifted, Dr. Granis said he expects to treat his wife to a Mother's Day dinner at home on May 10th. Russ McQuaid, Fox 59 News.